Even though it is widely known that there is no cure, an Arab physician is discussing a medical breakthrough that might eliminate autism. A drug protocol developed by Dr. Hamza succeeded in hiding all symptoms of autism in 35 cases out of 82 cases, according to the study whose results were announced. Furthermore, 44 out of 82 patients showed significant improvement on the overall clinical improvement scale. This research, which Dr. Hamza published in the publication Brain Science, represents a pioneering effort in the medical domain, and which, according to Dr. Hamza, confirms that a cure for autism is possible, thereby opening a vital avenue of hope for millions affected globally. We will now know more details.
Autism is a neurodevelopmental disorder affecting children, impacting their behavior, social communication, and perception. Autism affects 1 in 160 children globally, based on statistics from the World Health Organization. Furthermore, males are 4 times more susceptible to this disorder compared to females. The healthcare cost for children suffering from autism is 4 to 6 times the cost of care for children without the disease. Monitoring brain magnetic resonance imaging scans of children may help predict whether they will develop autism. Researchers discovered a possible correlation between brain swelling in the first year of life and an autism diagnosis by age 2, keeping in mind that earlier diagnosis can enhance the quality of life for autistic individuals alongside improving their careers and relationships. Behavioral therapy remains the most paramount treatment for the condition.
With us here. We will learn more about this topic, and if there is indeed a cure that eradicates autism. We have with us here in the studio the consultant for the brain and children's brain, Dr. Hamza, developer of a drug protocol for treating autism. Dr. Hamza, a warm welcome to you. We are hopeful for some promising news, particularly concerning autism, for which we have always been told throughout history that no cure exists. Today, are we facing a cure to completely eradicate autism, or a treatment that controls the symptoms accompanying autism?
Thank you for having me. This is a very important question. We are currently concluding our latest study, the third one, which we published 2 months ago in Brain Science, involving roughly 82 autism cases. And during our treatment of them over a period of at least 6 months, the autism symptoms vanished entirely in 43 out of the 82 cases we treated. Complete disappearance means the disappearance of all autism symptoms and the child returning to their normal state. Of course, this study is consistent with the first study that we published in 2020 with 18 children and the second study in 2021. The first was in 2020, the second in 2021, and we confirm all symptoms disappeared. Okay, the important question, did symptoms disappear? Yes, completely. The success rate reaches 60%, like any neurological illness.
Regarding the success rate you cite, does the treatment protocol differ depending on the child's age and the severity of their autism, or is this treatment universally applicable?
Of course, the younger the child is, the better the potential for activating and modifying the electrical response, leading to a significantly higher responsiveness to the medication. The matter is very simple. In our 10 years of work in Dubai focusing intensely on autistic children, one of the most significant problems we address is the autistic child's behavioral symptoms. There may be symptoms of psychosis and an inability to concentrate. With these medications, we activate the electrical medication, controlling behavioral and psychosis symptoms. Then we support them with concentration medications so that the child's focus increases, making the process of receiving information much greater. This means if the child was absorbing only 10% of the information, the electrical drug activates that 10%. However, when we boost their concentration to 80%, along with modifying their difficult behaviors, I have activated the brain 8 times, introduced information 8 times, activated the electrical drug 8 times. In a minimum period of a year, you notice the child starting to return to their normal state.
Is this treatment costly? Will its availability be restricted to certain demographics, or is it accessible to everyone?
That's a good question. I always tell parents the medications are on the market like spices, all from the same formula we made, but we changed the way the drug is used. The dosage, the timing of administration, and when to combine it with other medications, it's akin to creating a new spice mixture. I begin with the initial medication and proceed until I achieve the desired result from the first drug. If the symptoms disappear, excellent. If they don't disappear, I support it with other medications as needed to treat the remaining symptoms. Once the symptoms are controlled and concentration improves, we stabilize the medication for at least 6 months, up to a year. Afterward, we taper off the medication, similar to setting a bone fracture so that the break heals and does not reoccur.
Doctor, we always ask this question whenever we hear about a new treatment, a breakthrough, and it becomes headline news and an achievement, then it disappears. We cease hearing about it. What assurances do we have today that we have truly entered a phase where autism can be treated?
The assurance lies in the fact that we have published scientific research in credible, highly reputable Western journals. That is the primary point. The second assurance is that, regrettably, presently, all the medications in use, particularly the latest one, Wellbutrin, are unrelated to the underlying mechanism that causes autism. For example, if you look at an autistic child's symptoms, you see psychosis symptoms, laughing for no reason, crying for no reason, poor focus. They have obsessive-compulsive disorder, they must follow a routine, they have difficulty interacting with others, they have anxiety. Now, if you take a normal child who has anxiety, you treat them. You take a normal child who has an inability to concentrate and you treat them. But when all these symptoms combine in an autistic child, it is paramount that they should all receive treatment. They tell you, no, treatment is not warranted. If we assume we should treat him, we must treat them using the identical medications prescribed for concentration deficits and psychosis, which is what our study demonstrated, given that the symptoms are a combination of neurological symptoms, focus, and psychosis, meaning they must be treated with the same drugs, and this is what our study showed, which is a reason for the protocol's success.
Let us return to the fundamentals. Is the condition considered a genetic disorder, or are there other underlying causes?
Well, up to this moment, there is no specific cause. There is a very small percentage that might be genetic, but up to this moment, there is no cause that we can definitively name as the overarching and primary factor. We refer to it as multifactorial, meaning numerous factors can lead to the condition, but as of this moment, they are unknown now. It is very important that parents pay attention that not every cause I assume, because I build upon it and it's not certain for me. Why? Because, for example, some studies said the cause is a problem in the digestive tract. Since there is a problem in the digestive tract, it means they sought treatment for the digestive tract, which led to a wrong theory upon which a wrong drug was built, and efforts were scattered. And strong sources for parents, and we miss the most important thing in alternative treatments, which is time. The critical factor for me is the child's brain. The younger the child's age, the more robust the response will be.
We thank you very much. Thank you to the consultant for nerves and brain in children, Dr. Hamza Alsayouf, developer of a drug protocol for treating autism. Thank you very much.
We appreciate your time.
Welcome.